x-rays. Why don't you come in my room? So Sarah, I have to ask you some questions before we start.
Sure.
Could I have your full name, middle, with the middle initial, and your date of birth?
Sarah Arpini, 9987.
Oh, I got a cute story. I'll tell you after, remind me.
I'll stop my video now.
Sorry, I know, yeah, don't film it. Sorry. ADD a little bit. So, you're here for an x-ray of your backside. Did you fall onto
Yes.
your... We're going to take some x-rays of your sacrum and your coccyx today, okay?
Yep.
And also your SI joint. So there might be 3 or 4 x-rays.
Okay.
Okay, or images. And if you're in a lot of pain lying on the table, let me know. I'll put a little sponge under your buttocks. Don't say that. You don't have to. I have to ask you a personal question. Is there any chance you could be pregnant?
No.
Okay. And also, have you removed everything from the waist down? Do you have any piercings or in that area? Okay. So I'm going to get up on the table, okay, and lie on your back. Some ladies out here, well, right?
Yes. No.
You have to get down, Sarah. I have to show you how I would lie you down. Too eager.
So exciting.
I know you are. Okay, so how to get up. Well, really, I want to see you do this with your patients. Help them lie down and don't leave their side until they are secure on the table. You know what feels pretty good is that you get these announcements from Janet. It's things that I've told you. You know, that I think, kind of like I said, I think in clinic they're getting back to best practice. I mean, these things that they're talking about, they're not new things, you know. So, I'm going to need you to keep your legs in front, keep your feet down. How's your back, lower back? Very good. So I'm going to do the Ferguson for the APSI joints first. I'm going to go 30. Sorry, I did that. 35. You go between 30 and 35 on this. So you remember where we sent her? To his... The book talks about 1.5 inches above the pubic bone. So what I gave you was that 2 inches down from the ASIS, 2 inches up. It puts you in the area. Just remember the centering for your testing as far as, especially the registry. So I use this 3-fingered spread to center for, we use it for bladder, which we haven't done. We use it for lots of things, actually. I think we used it for L5S1 and also for this. Okay, and that's about where I'm going to enter. Okay, we go a little bit, they say 1.5 because we go a little bit lower than we do for the sacrum because we want to make sure we have all the SI joints, so, you know, the length of them. I'm columning in a little bit on her because I'm looking at her legs. And I'll mark her in just a little bit here. So it's going to be about here.
You wouldn't want to put it in the light field?
You could, I guess, if they let you, but that's fine. Light field's okay. I might follow lengthwise. Does that look more centered?
Yeah.
Okay. All right, Sarah, I just need you to hold your breath. Don't breathe. And click, and you can breathe. That's the APL5S1, AP axial.
SI joints.
this is the SI joints I'm doing first. Now I'm gonna do, I'll do an LPO for her SI joint beat. Okay, great. Perfect. Come back down. So which joint am I going for in this position? I can't hear you.
Move that away, you're right.
Good. Great. Use 8 by 10 for this as well. Oh, it needs 10 by 12. So I need about 25 degrees of weight into the LPO, and then we're going to do the side. In the real world, we do the other side. You always do both sides. Palpate ASIS. And go in at that level, 1 inch medial to that. I would use an 8 by 10. You can if you want also.
Then use an 8 by 10?
Mm-hmm. You don't have to, but you can if you want to. Because I'm actually collimated to that, just about. Okay, Sarah, hold your breath. Don't breathe. Click. You may breathe. So again, that would be maybe a routine series. They might have to do another, I don't know, for this. They might have to do a spot, lateral L5S1. But for the SI joints in Merrill's, it's the AP axial Ferguson, which is the 30 to 35 cephalad degree, and then both obliques. 25 to 30 degree obliquity, straight ray. I have 40, so it's a straight ray, and we're going always on the upside on the POs. We did look at the RAOs. Remember, it's the downside, basically the same. Thank you, Sarah. Come back down. Do that. So now we're going to do Sacrum and Coccyx. I'm going to do the APs, and then I'm going to show you both laterals, and then I'll show you the lateral that you're going to do them together, the Coccyx and Sacrum together. Okay. So what's the angulation for the AP Sacrum? 15 degrees. This way. Good. Okay. That away. Okay. I'm always center. 10 by 12 lengthwise. So I need to check your SID on this. The 15 degrees is not a great angulation. It's not going to change your SID that much. I'm going to palpate her ASIS, or do that 3-fingered. I'm going to go down 2 inches below the ASIS, or 2 inches up from pubic bone. So it's the same centering and positioning as for the Ferguson, pretty much. It's just the angulation is different. Come a little bit on her. You don't have to call me. For a while. Just get you one more time. Oops. Oh, I know what I did. Anybody know what I did wrong on the SI joint? What did I forget?
Shielding?
Yes, good. So for the SI joint, if I'm doing the right side, I can shield her left side. Okay, if I'm doing the other opposite. So it's a half shield. And for males, you can shield pubic bone. I mean, you can shield below the pubic bone. Okay.
Can it be in the light field like that?
In this case, for the SI joints, yes. For the, yeah, if you look at the light fields and I look and I'm way below the pubic area, yes. So, the thing is, if it's too low, it's not doing any good either. But again, you're right, you don't want it in the way. So the AP sacrum, with a 15-degree cephalad angle, what happens is that the coccyx ends up behind the pubic bone. Okay? Remember that? So now we need to actually shift in order to get the coccyx separate, I mean, it's nice on the lateral, we can do both, but just sort of from a, sort of kind of, from a positional point of view and a structural point of view of the coccyx, you have to go the other way to get it. Yeah, we go 10 degrees caudad for the coccyx, 8 by 10 on my light field, but actually we can come in, I'll tell you in a second, we are at like 6 by 6, okay? Let's see what 7 looks like. Do 7 by 7, sorry, I already wrote it down, but anywhere in between there is fine. Okay, the idea is that you don't have to keep it open. We're going for like a structure about that big, right? The centering is going to be the same. So all we do is shift our direction to downwards, and we're going to go 2 inches below ASS, so 2 inches up from pubic bone. It's about the same spot. Oops. Almost forgot to line up. I'll remember that. I usually try to line up the IR first with the CR, so. Oh yeah, we'll probably have to get used to it quite a bit. Okay. AP coccyx. Sarah, just hold your breath. Click and breathe. Anna. The identifiers down. Okay, needs to be up on your left side, facing that wall. Put your legs together and arms together in the front of you. Would you like me to double this pillow, perhaps?
No, that's fine.
That's good. First thing you want to make sure, and have them bend their knees way up, it kind of sticks the butt out, which is what we actually would like to feel, but it actually does that a little bit with the coccyx and sacrum. I'm going to check her entire spine. She's nice and lateral. I'm going to check for a slope. Not too much, actually. Let me just do it for the sake of a minute. Where's the where's the mushy other one?
Oh,
okay. Mushy's a technical term in case you didn't know that. It's in the medical dictionary. I'm gonna prop you just a little bit. Can you bend your knees up a little bit more? Perfect. Okay, lateral, sacrum, at the level of the ASIS, so you get a poke anterior to your patient. Right there. And you're going at that level and about 3.5 inches posterior to that point. But really you want to look at your patient. I'll take you back just a little bit. Patients are going to roll. At 10 by 12, you want to see some light. I'm going to bring this strip up close to the shadow. Watch your palpation, but you can actually go down to the beginning of the sacrum. This is a left lateral. I put it up by the hips because you have more room than you do down this way. So this is the lateral sacrum. In truth, is it going to give the coccyx for 99% of the people? Yes, it would. The issues and the reasons why someone would want you to just center over the coccyx is technique, because you were going through a really thick part, and then the coccyx is so small, not very dense, you kind of lose them. But I think again with CR and DR, watch out, Sarah. So now if I was gonna do the coccyx alone, I'd stay at this point and go down 2 inches from that. I would change my IR to 8 by 10. Bring in my collimation. And I double check. So the sacrum is very surface to the posterior aspect of the patient. So remember that. So for instance, the reason that's important is that you would want to go a little bit more posterior if you had to. Okay. The 2 points you have to be careful of is you have this really long, I shouldn't say long, this really sharp curve here. So you have a portion here you don't want to lose or clip, and then a point here you don't want to clip. So you have to like kind of go in the middle here. So this is for her coccyx. I would even bring it here. Let me tell you what you can do. Did I say 8 by 10? It's 8 by 10. So let's say 7 by 7 again. Try that. Remember, when 7 by 7 hits, it's not much smaller than 8 by 10 when you really think about it. 8, 7, get it? 10, 7. Okay, sorry. I'll make you feel stupid, but it took me a while. It looks very small anyway, okay? By the time it hits, it's not going to be that small. So don't be shy. It's a good practice in collimation. There. This is coming like this, okay?
So in lab, are we doing the lateral separate? Or
No,
are we doing
I'm going to show you how we're going to do it together, but I want to show you the 2 separate ones first.
Oh, okay.
Okay, so let's go back to 10 by 12. We're at the sacrum. Am I hurting you, Sarah?
No.
So start there and then 2 inches, just go down an inch. And you're going to be fine. Put the marker up here. And that's what you'll do for lab, so do them together. Just cut the difference between the 2 inches.